From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Okay folks, today I want to describe metacarpal fractures. As you can see in this X-ray of the hand, you can see different metacarpals and phalanges. You can start observing from the first, second, third, fourth and fifth. These metacarpals, you can see the fifth metacarpal has a fracture. So I want to describe the fifth metacarpal fracture in this lecture. You can see that very clearly. You can start observing the other metacarpals. You can see the carpal bones. You can observe the distal ends of radius and ulna. They are all fine. And you take a closer look at each one of them. And finally, when you come to the distal end of the fifth metacarpal, that fracture is very, very evident in this anteroposterior view. You can see that fracture going through all from the medial side to the lateral side. And if you take a lateral view, you can actually see the angulation here. There is a rule called 10-20-30-40 rule. That means you can, if the angulation of the metacarpal neck requires correction, it may be accomplished with gentle traction. And 10-20-30-40 rule, they are the maximum permissible degrees that may be tolerated in second, third, fourth and fifth metacarpal. So in second metacarpal you can allow up to 10 degrees, and in third you can allow like 20 degrees, in fourth you can allow like 30 degrees, and in fifth metacarpal you can allow like 40 degrees. Those are the maximum permissible degrees that may be tolerated. In this lateral picture, it's not that evident, the fracture, you don't see that much in this view, but you can go back to the other view. I have shown that very clearly. You can see in this view, yeah, you see that. You can see the angle very clearly with the fracture. So that is the metacarpal fracture. So the important things are the most common metacarpal fracture, the boxer's fracture, is to the neck of the fifth metacarpal. That is what you're seeing here. Through the fifth metacarpal, the neck of the fifth metacarpal fracture, that is known as boxer's fracture. A Bennett fracture refers to an intra-articular fracture at the base of the first metacarpal. For example, when there is a fracture at the base of the first metacarpal, we call it as a Bennett fracture. And when the fracture is comminuted, we call it Rolando fracture. So a fracture that is comminuted, we call it Rolando fracture. Most often the patients present with hand swelling over the dorsal surface and tenderness or the affected bone. And if you see any open wound in this area, you should always think of human bites, like when the injury could have been resulted from hitting over human teeth. So these kind of wounds resulting from human bites need copious irrigation and antibiotics, and you should take anteroposterior or lateral view of the hand in x-rays. And for the treatment is like if the manipulation is needed, you should always give appropriate analgesics like local lidocaine, and then using gentle traction you should correct any rotational deformity. If the angulation of metacarpal neck requires correction, you can do that with gentle fraction. Remember 10-20-30-40 rule, that is the maximum permissible degrees that may be tolerated in the second, third, fourth and fifth metacarpals respectively. Now, how do you treat it? You treat it most commonly with a splint. If the fracture is in second, third, or fourth metacarpals, then you should treat it with a volar wrist splint. So a volar wrist splint is needed for fractures in those three metacarpals. And if the fracture is like in fifth metacarpal, that is the boxer's fracture, then you should use ulnar gutter splint. Alright folks, and Bennett fracture that involves the first metacarpal, you use a thumb spica splint. So very easy to remember. If the fracture is in the second, third or fourth metacarpal, you use volar wrist splint. For boxer fracture or the fracture, you use a ulnar gutter splint. And for Bennett fracture that involves the first metacarpal, you use a thumb spica splint. So those are the most important points about metacarpal fractures. Thank you very much.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.